Hi, I'm Paul Pachter, CEO of Long Island Cares, the Harry Chapin Food Bank. Welcome back to another episode of Breaking Bread from Long Island Cares. This is our YouTube program that we provide to the public on a monthly basis to provide you with information about our programs, our services, what the Regional Food Bank has been up to, especially now in a climate of COVID-19 and the global pandemic. Since March 13th, Long Island Cares has implemented our emergency response program, reacting to the needs, responding to the needs for emergency food here in Nassau and Suffolk County due to the COVID-19 pandemic. And the numbers are staggering, and we're going to get into it with Dr. Jessica Rosati, Chief Program Officer here at Long Island Cares, who since March 13th has been spearheading our efforts responding to COVID-19. Jess, welcome.
Thank
I know
you so
this
much.
is the second time you've been back to Breaking Bread.
Yes.
So here we are, 8 months later, responding to an incredible increase in the need for emergency food here on Long Island. Let me share some of the numbers with our audience. Since March 13th, we have provided emergency food assistance to more than 128,000 people who have visited Long Island Cares for the very first time. And they visited us because of unemployment, underemployment, furloughs, living in self-isolation, having to quarantine, not being able to go out. And that has driven people to the Regional Food Bank for emergency food assistance. When you add that to approximately 66,000 people who continue to utilize our satellite locations, which we'll talk about, we're looking at about 195,000 people currently who are receiving emergency food assistance here on Long Island. And that represents approximately a 43% increase in the number of people who are struggling with food insecurity. Just right now, our model in dealing with COVID-19, the first step was to put you in charge of it. And that was a good move. But we are providing emergency food assistance right now at 18 pop-up locations, 6 satellite locations, about 7 mobile outreach units. What's going on out there?
So, I think this is a crisis that Long Island has never seen before. And one that I don't think we were fully prepared for the abundance of need that was going to start coming to us. And if you recall, we made a decision very early on not to stop any of our programming. Right. We've built a very good rapport, I think, with Long Islanders over the past decade with bringing food to the people where the people are and when they need it. And it was very important for us to continue the integrity of our programs, but, revise in a way to ensure that we were safe and the people that we were serving were safe. And so very early on, we had to change the way we did things. And, I think it brought us back quite a few years in regards to food insecurity and the whole model traditionally of just providing a bag of food, opposed to more modern times where all of our locations really focus on client choice. The pandemic proved our inability to do that safely, right? We had to stop the way clients were coming in and accessing the food because, with good reason, people were concerned, our clients, our staff, our volunteers alike. But it was important for us to continue to make sure that people had access and continued access because people were coming in droves to our sites, to our programs, calling for home deliveries. And so, we sat as an executive team and decided that we had to come together and put together food boxes. I think we had an edge because we have 2 very talented nutritionists on staff that made sure what we were putting in those boxes was nutritionally sound, were foods that people would like to eat, and be able to prepare safely in their home, and more importantly, enable our programs, our staff, and our volunteers to safely distribute that food and make sure that people had a continual access to nutritious foods.
Mm-hmm.
And that's pretty much what we've been doing since. I think we've been very fortunate with some of the partnerships that we've made over the 8 months in creating, pop-up food distribution models, because, we've always steered away from mass distribution.
Right.
That's not our model.
Mm-hmm.
We want to talk to the people.
Right.
We want to see the people. We want to be able to correspond and be able to really assess what those needs are. So when we do create our partnerships, they go beyond the provisions of food.
Mm-hmm.
And I think we've been able to do that successfully over the past 8 months. Our staff are tired, but we've been really fortunate, and we're not easing up. Unfortunately, I think the numbers are going to continue to rise in the next couple months.
Well, they're certainly on the rise now. You brought up our model.
Mm-hmm.
And, if people across the country are turning on cable news or their local news, they're seeing thousands of cars
Right.
lined up in huge parking lots, driving through and getting a box of food put in their car. And that's a wonderful response, and people will get the food that they need, and, being able to social distance. But we took a different road
Right.
than most food banks across the country,
Right.
in that we have 374 member agencies that we support, on a regular basis. These are the soup kitchens and the food pantries. And because we're essential services, because of the need for food, they're essential services. And we decided that not only were we going to, work with our satellites and then have the ability to open up the 18 pop-up locations, but we were going to also work with our member agencies that were open. And in March, it was approximately 301, 302 that were open. Now, of course, there's only 13 of them that are closed now. Everyone's starting to come back. The 18 pop-up distribution sites was a very public move that was made by the town of Hempstead, and in which they provided Long Island Cares with $2.4 million to open up 18 pop-up distribution sites in high-need communities. How did we operationalize that? What did it take for us to open up now 18 individual food distribution centers?
In a nutshell, staffing, food, and oversight. I'm very proud of the work that we've been able to accomplish in the past 8 months, because, when Town of Hempstead came to us and said, this is what we'd like to do, I think it took you and I about 3 weeks to, go and visit every possible location, determine the logistics on site, and within a week or two have them equipped with the staff, food, and volunteers in order to distribute. I think our quick response has helped a tremendous amount of Long Islanders sustain over the past 8 months. I think one of our greatest strengths here at Long Island Cares is it's not a matter of, what do we do? It's just, let's get it done.
Right.
And, whatever that may be, we come together to do that. And, we've been very fortunate. In the past 8 months, we've grown our staffing tremendously. And have been very fortunate with amazing temporary staff who are showing up day in and day out, serving the public. Over the past 8 months, they've built rapport with community members, which have led to additional opportunities for our organization to work a little bit more knee-deep in high-need communities. And that's really what we're about. Unless we address the full person, look at the full needs and come together as a human service organization and meet those needs, how are people going to get out of poverty? And I think what we've been able to do has shine a light on the actual need on our island. I'm grateful that we have the support and able to serve that. I think that as we go into the next year, we're really going to see how those numbers stick. Because I think what we have been able to do in the past 8 months is really offer a service to people who weren't aware that the support was there. So it'll be interesting to see what 2021 brings in regards to how many people continue to come to our services for support.
I think the most impressive part of opening up the pop-up locations was how quick it was to hire 30 temporary staff people.
We did it very quickly.
And to do it in such a way that people who lived in the communities where the pop-up locations were open applied for these jobs, and we were able to hire local people who knew their community, who knew the demographics, who were familiar with the resources. And the numbers, of course, began to grow. If I go back, I think in early March, April, maybe even May, we were averaging anywhere between 17,000 and 20,000 people a month.
Correct.
And here we are now in November, and in October and November, we've been averaging about 15,000 people a month. So the numbers have come down slowly. But it's staggering to know that in the past 8 months, we have nearly doubled our distribution of food.
Yeah.
Currently, we have distributed over 14 million pounds of food, and that equates to 12 million meals.
Isn't that crazy?
In a region, that's only populated by 2.8 million people, we're providing 12 million meals. When the people are coming to the distribution sites, the pop-ups, or even to our satellite locations, and the staff begins to interact with them, and as you said, when people are coming now, we have the prepared boxes or the prepared meals, and we give them out, and we are working on a transition plan for January where we're going to slowly open up the satellites so people can come in and pick their food. But what kind of information are you getting, and what are you hearing from people as to what's driving the need up by 43%?
With good reason, people are scared. They're scared to go to their local supermarket. They're scared to interact with other people in large group settings. Just from the transition from March through probably August, just the amount of deliveries we were doing because people were uncomfortable to come out. What we've seen at the pop-ups and through the satellites is proxies, a lot of proxy. So, that's a conversation. If you're Paul and you're coming from Belmore, but your neighbor Mary is elderly and can't go out, well, Paul, let's give you food for Mary. So those conversations need to happen. So first and foremost, we're taking the demographics. Who are you? Where do you live? How many people are in your home? We want to make sure that we are capturing what towns are in most need, so we have the supports in place to serve that need. But more importantly, how many people are in your home? How many people are you really working with? How many mouths do you have to feed? Let's make sure that we give you enough food to be able to sustain that and feed your people. But more importantly, nutritious food, because that's anybody can give a can of food. But we have to make sure that people are getting the right types of food. And in the satellites and through the pop-ups, we're able to really talk to people about that. And we've altered what we've ordered, what we've distributed based on those conversations. In March, when the pandemic hit Long Island, it was hysteria.
Right.
Our supermarkets were bare. And remember, and we had oodles and oodles of calls a day of people looking for specific items. And that really, I think, helped steer us into what we had equipped the food bank with to make sure that people got what they need. We did it in Sandy because it wasn't food, remember? It was generators, it was blankets, it was heaters, and anything else that...
The small grants that we gave out.
Oh my gosh, it was, oh my goodness. And I think that separates our emergency response and recovery services opposed to other nonprofits, because we're really assessing that need. And those conversations have to happen, because I think over the past 8 months, we've tapped into a population that wasn't known to the Food Network system. And in order to ensure that we're continuing to meet those needs, we have to continue to assess those needs.
We have to continue to meet with the people that come visit us. We have run out of time, and we'll do this again because there's so much more to discuss. We didn't even touch on our new Bethpage Super Client Choice Pantry, but we'll get there maybe with the next episode. My guest today has been Dr. Jessica Rosati, Chief Program Officer for Long Island Cares. And we're talking about Long Island Care's role in responding to the COVID-19 pandemic in Nassau and Suffolk County, a program that right now has seen close to 200,000 people coming for emergency food, providing over 12 million meals, and increasing our purchasing power and distribution by about 78%. If you enjoy what you're watching and you want to learn more, please consider subscribing to our YouTube channel. Until next time, here on Breaking Bread, this is Paul Pachter, CEO of Long Island Cares. We'll see you soon.